Hello, I'm Dr. Ruth Roberts, your pet's ally. This month we're going to be talking about arthritis and mobility that has just gotten to be such a big issue for pets, especially as they age, just as it has for us humans. What's been interesting is that for older people now, they're focusing on teaching or reteaching people how to be mobile to improve their balance and things of that nature. And I think that that is an issue for older pets as well. So let's talk a little bit about why mobility and movement is so important for older pets. And to start with, mobility is the ability to move a joint through a normal range of motion. So for instance, in the hand, that's a pretty complex joint, so it's got a lot of different angles it can move through. Same thing for your dog or your cat's wrist, essentially. That's what the paw connects to. But more importantly, for the elbow, if you don't have that full range of motion and you only have this, so instead of 180 degrees, you've only got something like 25, 30 degrees, that's a big problem because that's going to affect the entire rest of the way that your body moves. And if you're taking very mincy steps like this all the time, then you get all of this muscular tension across the chest, across the back, and that starts to kind of lock down the rest of the body, which makes it much more difficult for pets to move easily. So that ability to put a joint through a normal range of motion is really important. And so that's where a lot of physical therapists are focusing on and things of that nature. Later this month, I'm going to have a good friend of mine, Mike Daly, who is a massage therapist for dogs and cats, kind of come on and help you work through sort of a rough plan to get your pet warmed up and actually to improve mobility and things of that nature. So there's a lot of different causes. Most often arthritis is the cause of limited mobility, and as we limit the pet's ability to move and they worsen balance, then they start losing function in daily life. So for instance, they're no longer able to jump on the sofa. They're no longer able to go up and down stairs. They're not able to do the normal things that they would like to do in life. So that becomes a big problem. The more limited they become, the more difficult it becomes for them to continue to move. And so it gets into this really vicious cycle. And so what that means is that there's with more movement, there's more blood flow to the brain, to the internal organs, to the muscles, which helps to maintain muscle mass. And so if we're limiting mobility, then we're decreasing that blood flow. And so not only does the animal become more uncomfortable and have difficulty with movement, all of the other internal organs and the brain starts to have difficulty. So it's really important to focus on mobility and movement. The other thing is that in traditional Chinese veterinary medicine, stagnation is a cause of mobility loss. Excuse me. Pardon. Sorry guys, I got the flu and I thought I'd get through this okay. So stagnation is what leads to pain, weakness, and all sorts of other diseases in traditional Chinese veterinary medicine, including cancer, interestingly enough. So that's another reason to keep moving. And so what I'd like you to do is kind of look at where your older pet is right now with mobility and movement. Are you walking just a few minutes a day? And if that's the case, then just add a little bit, like 2 minutes extra a day, and see if you can get your pet moving. So sorry. All right, so I'm going to cut this one short. Next week we'll talk more about this. There was a question about hemorrhagic bowel syndrome, which I'll answer below in the questions. Take good care, guys. Cheers.